What do people usually do to solve their chronic pain?
Okay, so usually they do the wrong thing to solve their chronic pain. And that is they persist in looking for the physical cause of their pain. Mm-hmm. They go from doctor to doctor to doctor. They go from x-ray to scan to more and more invasive different kinds of assessments of their pain. And they take more and more medication, or they have surgeries. And there's all kinds of bizarre and crazy surgeries out there. And because they're looking in the wrong place, they're persisting to try to fix the pain in their body when it's not in their body, or they're trying to fix the pain that's in their head, which is not in their head. These solutions don't work, and their suffering gets greater and greater. And for some people, it works. So we have to be clear that if you had an accident and there was a piece of glass lodged in your chest, and we take the piece of glass out, then the pain will go away.
Yeah.
And some people have that kind of pain, but then the pain goes away. It's when 6 months later, the glass is gone and the pain is still there. And it becomes saying, no, your pain originated in an injury, but it's not caused by your injury anymore.
Yeah. To qualify that the person have chronic pain and we can help is basically, of course, not coming in and having certain objects that is basically lodged in their body that cause.
I had one person who called me who was in terrible pain. And I said to him, what happened? And he said, no, he had a motorbike accident yesterday. So then I said, well, no, you don't need us. You need to go to your GP.
Right.
He'd been discharged from hospital, but he was still in pain and he didn't need us. And I said to him, if in a few months' time when your body's healed, you still have pain, we can maybe talk then.
What is the minimum time that you would qualify as a chronic pain, right? So are you saying that it's around 3 to 6 months?
So the minimum time would be 3 months, but there are some people who have a serious accident who 3 months afterwards are still like in rehab. It could be longer than 3. The minimum would be 3 months, but if a person was like still on crutches after their accident, then we would say you had pain over the long term, or it might be chronic, but it wouldn't be a neuroplastic phenomenon yet.
If their body in a way is still healing, it may not qualify as a chronic pain.
Yeah.
It is basically just your body needs time to heal, that's why there's pain. But after it's completely healed or cured, then it's still having some issues or pain, then that's pretty much chronic pain. What is their usual process to get their chronic pain solved? Do they call their GP or go to a hospital? Usually, what do people do?
If they don't come to us, currently they go to the GP or they go to the hospital. Some hospitals have pain clinics, or they go see a pain specialist. A lot of pain specialists are actually anesthetists or psychiatrists, and some of them are surgeons. And some of the hospital pain clinics are very good, but they'll do what they call a multidisciplinary program, which involves surgeons, anesthetists, physiotherapists, sometimes psychologists. But in my opinion, there's still far too much focus on the body. And often what they'll do is they'll have, the people who I see, many of them have had 6 or 7 different procedures. They've had what they call guided injections, that they have an MRI and they put an injection of cortisone at some point in the body. They have what they call, I think, electrical ablation. And sometimes some people will have their nerves cut, or they'll have their nerves moved, or they'll have their spines fused, or they'll have Botox injections, and the Botox kills the nerves.
Yeah. In terms of this kind of procedures like Botox injection, most of them are just to suppress.
Yes. So some of them work, some of them wear off. So the cortisone injections wear off after 3 months. Botox injections also wear off after a while. Sometimes there's a hope, and sometimes it does work, that it will actually shut down the process. Now, when the Botox will wear off, the pain comes back. Some people, they'll just book in every 3 months for their Botox injection.
Okay.
Or they'll go to the psychiatrist and they'll just get huger and huger dosages of different medications.
Then
people come to us because they went to the doctor and the doctor said, increase the medication dosage. And they think, if it's not working now, why is it going to work then? Or they're tired. We'll send you for another injection. They said, we've had 2 before and they didn't work. Why would this one work?
So they become dependent.
If it worked, it could become dependent, but often they're just not working. People are hooked on the idea that there's a physical cause of my problem, but my doctor doesn't know what it is, and so I'll go to another specialist and then he'll find out and he'll fix it. But because there's no physical cause of persistent pain, no specialist is going to fix it. Or people have what we call silver bullet theory, that there's something out there in this tablet and this doctor knows it and this doctor will give it to me and it will fix my pain. And they're addicted to going to doctors. addicted to the idea that if they go to the right doctor, he will find the right problem. He will have the right solution. And they come here and they say, my doctor doesn't know what's wrong with me. The doctor does know what's wrong with them. They have persistent pain with no physical cause, but either he didn't say it or they didn't hear it, or he's just
trying it out. See how it goes. Okay. That's the usual process, is that they call their GPs and then they get recommended to a certain specialist or a doctor and getting some sort of treatment which is drug related or surgery related, and then it just snowballs from there and they have no way out because they keep on going around and around.